Hi everyone, this is Mr. Neil Wrighter, also known as the Wax Whisperer. Thank you for tuning into my latest video. For anyone who doesn't know who I am, I'm a UK-based consultant audiologist and clinical ear care specialist. I'm also the founder and director of a company called Clearwax, and Clearwax are the manufacturers and developers of the iClearScope endoscope, which is the device that we're using to perform and record this procedure. I had a client here who I attended a few weeks ago. It's actually a local GP. The GP was blissfully unaware that their right ear was full of wax until they went into the jacuzzi and they got their ears filled up with water. So if you've got a build-up of earwax, it's not uncommon for it to go unnoticed. We often see a lot of people who have got a tremendous amount of earwax, and I'm just staggered that they didn't attend earlier, and they always comment that they were just completely unaware. And the reason for that is earwax build-up secretion is a slow, gradual process. And if, like with anything slow and gradual, it creeps up on you. Similar to when people develop age-related hearing loss, because it's a really slow, gradual process, a lot of the time it's not the patients themselves that acknowledge and realise they've got problems with their hearing because they don't know any better. If they lost their hearing suddenly, then they would be aware that, or compared to the day before, they're not hearing as well. So, and it's similar with earwax. So it's got very mushy, wet type of earwax, quite glutinous, sticky. So I've removed the outer layer of earwax. We're not able to use any other instrumentation to remove this medial lump of wax. When we say medial, we mean deep, closer to the eardrum. So there's no opening there for me to insert a Jobson horn or an ear hook. That would involve making contact with the bony part of the ear canal to get in behind, which can be quite uncomfortable. So I've just put some olive oil drops in there. It's still very impacted, but we are loosening this plug of wax. So it's just a bit blurry just because of the oil. So although I drain the ear post-procedure, so we soak the ear for a few minutes with the oil in situ, and then I had the patient tilt the head the opposite way, so the ear with the drops in is now facing the ground to drain some of these drops. Still, you've got some oil behind, and it's hence why he felt his symptoms worsened after getting into the jacuzzi. So the water obviously got into the ear, in and behind the wax, created a puddle, and at the same time the wax absorbed some of the water in the jacuzzi and expanded and swelled. So just gently tugging at this wax in little circles just to loosen it. The wax is trapped in a narrowing of the ear called the isthmus. There's two narrowings in the ear. The first one is about 1.5 centimeters in the ear canal, where the cartilage and the bony part of the ear canal merge. And there's also another narrowing, and a narrowing is called an isthmus. There's another one about 0.5 centimeter away from the eardrum. This wax was lodged beyond that narrowing. So as you can see, we've managed to extract this with the help of some olive oil. That's the patient's tympanic membrane, slightly red, and that's because the wax was really compacted. It expanded and swelled. You can just see at the entrance, after the patient suffered from the earwax impaction, they informed me that they just rubbed their ear, and they know better, obviously their doctor, their GP, but it was just, they couldn't resist that urge, and it's just caused a bit of abrasion of the skin cells near the entrance. So there's just a pocket of skin here. I'm just tapping it to make sure it's not a bony protrusion called an osteotoma, which it wasn't. It was just a thick layer of skin that's been abrased, and that will now naturally shed. There's nothing, we don't need to do anything with that. And it's just some soft wax near the entrance. I'm just going to mop up, hover over. Still got some oil there, so the patient's got some cilia with some oil that's coated around, hence why it's slightly blurry. There's the tympanic membrane. It is clean as a whistle. And the patient, whilst it was here, I said, oh, let's have a look in your left side. And there was some dry wax in here. So here there's a big opening for me to use a Jobson horn. I've just inserted it over the earwax and in and behind. We're gently bringing this wax forward. This wax is quite lateral. So when we say lateral, we mean in the outer part of the ear canal near the entrance. There's some dead skin keratin attached there that we've just released off the ear canal, as you can see. And there's just a bit of residual dead keratin wax on the posterior canal walls. When we say posterior, we mean the back part of the ear canal. And again, it is quite lateral, just used to Jobson horn, just to loosen that. There we are, that's the patient's left eardrum, very healthy, textbook. And I've just weighed that last piece of wax. It's just measuring 1/4 of a gram, so 253 milligrams. I hope you enjoyed that video, guys, and wherever you are in the world, you're keeping well and safe, and I shall hopefully upload some more videos during the course of the week. Thank you, take care, bye.